Hey everyone! Today I'm diving into a crucial topic, malaria. This is one of the most common and serious infectious diseases worldwide. So let's break it down. First off, what is malaria? Malaria is caused by Plasmodium parasites, which are transmitted through the bites of infected female Anopheles mosquitoes. Once bitten, these parasites enter your bloodstream and travel to your liver, where they multiply. Sounds intense, right? Now let's talk symptoms. If you've been bitten by an infected mosquito, you might notice flu-like symptoms within 10 days to 4 weeks. These include fever, chills, headache, muscle aches, and fatigue. In severe cases, it can lead to jaundice, seizures, and even coma. If you experience any of these symptoms, seek medical help immediately. So, what causes malaria to spread? It's mainly due to the Anopheles mosquito bites, but it's also prevalent in tropical and subtropical regions where these mosquitoes thrive. Poor sanitation and lack of preventive measures contribute to its spread. Prevention is key. Here are some tips to protect yourself. Use insect repellent containing DEET. Sleep under insecticide-treated bed nets. Wear long-sleeved clothing and pants, especially during dusk and dawn when mosquitoes are most active. And if you're traveling to high-risk areas, take anti-malarial medications as prescribed by your doctor. Remember, understanding and prevention can save lives. Stay informed and stay protected. Thanks for tuning in, and take care of your health. See you next time.